This is the second of these three articles I mentioned before, published before April 1st. In fact, this was published on April 1st, and it comes from the Australian newspaper, and it's really scathing of Professor Ferguson of Imperial College, who made predictions of massive numbers of deaths if the lockdown strategy wasn't pursued. This article is from the Australian newspaper and published on the 1st of April. The journalist was Jacqueline McNay, and she's their foreign correspondent. His name is forever tainted with a seriously flawed forecast about foot and mouth disease that resulted in the unnecessary slaughter of millions of livestock, that saw pyres burning across Britain and cost farmers their livelihoods. That was in 2001, and now the man who convinced the then Prime Minister Tony Blair to take such extreme action to handle the foot and mouth outbreak is behind Imperial College data that the UK government is relying on to inflict the most extreme social isolation measures in the coronavirus pandemic. Professor Neil Ferguson heads an Imperial College London team that has claimed 510,000 people in the UK would die from coronavirus if nothing was done, and by introducing various distancing measures, the curve could be flattened so that as few as 20,000 people would die. Given Professor Ferguson's unquestionable influence on the UK action, and possibly by extension Australia's two-person social distancing policy that came into effect overnight, his numbers are being carefully scrutinised by others. Early in March, Professor Ferguson and his team originally underestimated by as much as half the number of people who might require ventilators, prompting a drastic change in policy by Boris Johnson to try and suppress the virus rather than mitigate the crisis. Before the UK went into lockdown, Professor Ferguson's team warned 260,000 people would die if the less restrictive measures remained in place. But just days ago, Professor Ferguson told a parliamentary committee the numbers of deaths would be substantially less than 20,000, and his team predicted it could be as low as 5,700, less than the annual toll from seasonal flu, with at least two-thirds of deaths in people who would have died anyway from underlying health conditions. After an outcry about his changing stance, Professor Ferguson insisted he had been consistent throughout the crisis, and the revised prediction of the potential death toll was because of the strict lockdown put in place by the British government after following his advice. Professor Ferguson claimed over the weekend that the lockdown would have to stay in place until the end of June, claiming any lift of measures earlier, say in May, would be optimistic. Yesterday, Deputy Chief Medical Officer Jenny Harris mirrored Professor Henderson's epidemiological assessment. I think the journalist got the wrong name there. I think she meant Ferguson. Warning it could take 6 months before a semblance of normality began to return. Dr. Harris said the lockdown measures would be reviewed in 2 to 3 weeks. She said, if we are successful and have squashed the top of the curve, we say that's brilliant. But we cannot suddenly revert to a normal way of living for those efforts. It will be wasted, and we would see a second peak over the next 6 months. The British government has effectively put the nation under house arrest and sparked nationwide anxiety on the basis of Professor Ferguson's mathematics, most severely impacting on those aged over 70 who have been told to remain indoors. Some police forces have hotlines to dob in a neighbour. I think that must be an Australian expression. if they exercise more than once a day, an ominous Stasi-like development. All the while, the British economy is tanking, with predictions the unemployed will rise to 2.75 million and GDP plummeting 13.5%. Another professor, Michael Thrusfield, of Edinburgh University, has claimed Professor Ferguson's severely flawed errors 19 years ago led to the cull of more than 6 million animals that did not need to die. Another government study also found Professor Ferguson and his team at Imperial College used models during the foot and mouth crisis that, quote, were not suitable for predicting the course of the epidemic. The models also remain not validated. Their use to predict the effects of control strategies was therefore imprudent. The same Professor Ferguson predicted as many as 69,000 deaths from swine flu in 2009, when only a few hundred died. It was in fact less than 500. Professor Ferguson's coronavirus gloom contrasts with a study led by Sunitra Gupta, Professor of Theoretical Epidemiology at Oxford University, who believes fewer than 1 in 1,000 of those infected with coronavirus need hospital treatment, with most having mild or no symptoms. She also believes that millions of Britons may already have had the disease. And these are my words. This study has been shot down by several so-called experts, as there's no evidence to back her belief. If she's correct, then the death rate will be substantially lower than that predicted. Another critic of the Imperial College study is John Ioannidis, a professor in disease prevention at Stanford University. That's a sort of major university in the United States. He told the Telegraph UK, the Imperial College study has been done by a highly competent team of modellers. However, some of the major assumptions and estimates that are built in the calculations seem to be substantially inflated.